didn't hear him screaming because he did not have his hearing aids in. So I'm going to read through this article. A Florida gastroenterologist has been disciplined after 2 recent colonoscopy procedures went wrong on his watch, including at least one where he couldn't hear an improperly sedated patient scream because he wasn't wearing his hearing aids. And forgive me if I mispronunciate the name, but Dr. Ishmaeli Persuade, 84, has been placed on probation by the Florida Board of Medicine after the botched procedures, according to a State Department of Health administrative complaint viewed by the U.S. Today. So it's 2 colonoscopies that took place on June 5th last year at the Tampa Ambulatory Surgery Center. During the first, he is said to have improperly delegated medical tasks to surgical techs who did not have a license to practice medicine. The complaint reads, oh, this is just going downhill fast. The tech who was instructed by the doctor to perform at least one task from a list including scope insertion, scope manipulation, manipulating an instrument over polyps or tissues, or removing polyps or tissues. Now, this is insane, and the tech should have definitely reported this, because this is an issue, because if something goes wrong, the doctor and you, I feel, are responsible. In the second problematic colonoscopy that day, the complaint says the doctor began inserting the scope before the patient was fully sedated, causing him to scream out in pain. He did not immediately stop the procedure when it became apparent that the patient was not fully sedated. The complaint reads in part, identifying his inability to hear the patient's shouts as to the reason. So where are the techs when all this is going on? That's what I'm sitting here wondering, reading this, like, where are you? And I'm shocked that no one heard him screaming. Citing an emergency restraining order, so they ended up slapping him with an emergency restriction order last September. The Miami Herald reported this, that the problem with the sedation was due to an issue with the patient's IV line. The patient began to yell and shout that he was in pain and could feel everything. Oh my God. According to the order viewed by the Herald, the doctor continued to move the scope while the patient continued to scream. This sounds like a horror movie, like a real horror movie. And I think this is one of the fears I could say we all have if you ever had to go under the knife and, you know, you aren't fully sedated, or you wake up in the middle of that. Like, I couldn't imagine. I've had a couple of, not surgeries, but I had to be sedated for a couple of shots that I had to get. And I know I wouldn't want to be up and conscious for that. I could only imagine having an instrument shoved inside your body and it's moving around and you feel everything, because I know that has to be very, very uncomfortable. The outlet also wrote that during the second procedure, a hospital administrator in the room told the doctor he had to wait, prompting the doctor to lean over to the patient and shout, "I know," while continuing to manipulate the scope. During the investigation into the incidents, the surgical tech revealed she routinely assisted the doctor with an assortment of medical tasks beyond her training during colonoscopies, including indicating this was because the doctor is unable to perform them himself. Why are you, as anyone in a medical field or anyone dealing with anyone's life, why are you not reporting this doctor who should not be performing anything on anybody? Someone could get seriously hurt. Someone could probably get killed. You know, he's not fully aware or unable to do the task. There's internal bleeding, puncturing a vein or something. But it just seems very irresponsible. Even I have to call out the tech too, even on the tech's part. She told investigators she pushes the scope, holds the scope, cuts polyps, cuts clips, and removes and pulls out specimens, the emergency order says. Like, she should get her license revoked as well. Cause I understand.